So hi everyone, thank you for joining us in this session exploring innovative approaches to data stewardship. My name is Jack Hardings, I'm from the Open Data Institute and I'll be chairing this session, which will consist of 3 short talks from our guest speakers who I'll introduce shortly, and then a panel discussion. We're really hoping for that discussion to be led by your questions, so please do drop them into the window as they spring to mind, and they should work their way to me to put to the panel. Before we get started, I just wanted to set the scene a little and describe what we're hoping to get from the session. So the first thing we'd like to do is to explore and discuss this concept of data stewardship, which has emerged as a really important foundational concept for our work at ODI and others thinking hard about data sharing and governance too. And so to us at the ODI, stewarding data involves the real basics of collecting, maintaining and sharing it, but also the really important decisions around who should have access to that data, under what conditions, for what purposes, and so on. And so it really affects what we can use data to build and to create. So the types of technologies and services we can develop, and also the types, in this context perhaps, of the types of health research and development that we can use data to enable. But we've also seen how irresponsible data stewardship, so the pervasive collection of data perhaps, or the sharing of it with the wrong actors, can cause harm to us as individuals, communities and societies. And so we're really pleased to have Carly Kind, Exec Director of the Ada Lovelace Institute, join us to talk more about data stewardship as a concept, and also some of the new approaches or mechanisms that the Institute has been focusing on. We'll also hear from people who are experimenting and knee deep in running some of these novel and innovative approaches to data stewardship. There's a lot of experimentation in this space, especially around approaches from the bottom up. So those that enable individuals to play a more active role in creating and controlling data about them. And it's in that spirit that we're really delighted to have Wenhua Li, CEO of the charity Action Against Age-Related Macular Degeneration, and Mad Price Bull, Exec Director of Open Humans, to share their very practical experiences with some of these data stewardship approaches. We'll then come together to try and make sense of everything. And as I've said, take any of your comments and questions, so please do get them in. And we hope that will prove a useful final session before we go back to the closing plenary. So without further ado, Carly, I'll hand over to you to tell us more about data stewardship and the Ada Lovelace Institute's work on the topic.
Thanks, Jack, and thank you so much to HDI UK for having me here today for this interesting conversation. I am going to share my screen. Just give me one moment. And hopefully you can all see that. So the Ada Lovelace Institute, for those of you who don't know us, is a independent research institute based in and established by the Nuffield Foundation, with a remit to ensure that data and AI work for people and society. And that means we're interested in the ethical questions that arise with the use of data and data-driven technologies and the societal impacts of those technologies. We've been working also, like ODI, on data stewardship for the last couple of years, really as a means of thinking about what responsible and trustworthy use of data looks like. So for us, data stewardship is the collection, use and management of data in a way that demonstrates responsibility and trustworthiness. And I think that that's implied in the definition that Jack gave as well. And so data stewardship is thought about as related to the idea of some kind of fiduciary or trust level of responsibility that a steward has towards the data. And there's some really interesting origins of the concept of data stewardship in things like environmental policy and practice, which considers the use of environmental resources by actors using those resources as a kind of form of stewardship, that one doesn't own an environmental resource, but rather responsibly and trustworthily stewards it for a period of time for the purpose of achieving social benefit. At the Ada Lovelace Institute, we've been looking at 2 buckets of mechanisms for enabling data stewardship. And I think there are more than 2, including technical mechanisms for enabling data stewardship, such as privacy-enhancing technologies. But we're interested in 2 buckets, one of which is participatory mechanisms for data stewardship. and the other is legal mechanisms for data stewardship. And I'm going to talk very briefly about those now. So participatory mechanisms are those types of practices and initiatives which enable people affected by the use of data and data systems to be involved in their governance. Broadly speaking, we are big advocates of participatory and inclusive approaches because we find that they always engender better outcomes, both because we understand better what the practical concerns and needs of a cohort is, also the ethical concerns, but importantly because we get more diverse input into design and system design, and we guard against groupthink, which is very important. We also build the legitimacy of the technology, so we're more likely to see public trust and confidence in systems that involve participatory elements, and we can increase accountability around systems which can be very difficult to have influence over. We think about participation as a range of different questions or options across a spectrum. And this is a spectrum that was developed by Arnstein, in which we've kind of adapted, which thinks about participation as going through the most basic forms of informing a data subject or a person affected by data collection or data use and management, which is really a one-way process in one direction, right through to a process of empowering the individual and the data subject in the design and management of a data system. And somewhere in between there are a range of different options. So some involve, for example, some mechanisms such as involvement might look like a citizen panel or a deliberation, something like that. Collaboration might encompass co-design, whereas empowerment would be about handing over responsibility and power directly to those affected. We are hoping to publish soon a report which looks at participatory mechanisms and in particular different use cases that we're starting to see emerge. So one, for example, is the UK Biobank, which has a data donation approach and which also employs things like panels of data subjects who are involved in the decision-making around their data, cooperatives, which I'll come to shortly, and the new initiative coming out of Wellcome around a mental health data bank, which I'm sure many of you in the audience will know more about than I do. We would caution none of them are without complexity. Some have been critiqued, but they're nevertheless novel forms of data governance that involve participatory methods. The second form of data stewardship that we're looking at is legal mechanisms for data stewardship. So there we're really looking at how can legal structures help us achieve trustworthy and responsible data use that unlocks social benefit that's fair and equitable, and that also permits data sharing while also complying with legal rules and in particular individual rights. We looked at 3 types of legal mechanisms as part of a working group that was established by Dame Wendy Hall, and of which Jack was a member, along with a range of other eminent practitioners and legal experts. And they developed thinking and exploration of 3 different types of legal mechanisms: data trusts, data cooperatives, and corporate and contractual mechanisms. You can find these all explained in great detail in a report that we published earlier this year called Exploring Legal Mechanisms for Data Stewardship. I'll very, very briefly run through them now. So the first is data trusts, which is based on a legal precept which exists under UK law, which is around trust law, and data trusts operate by enabling individuals to delegate their data rights to a trustee who then exercises those rights on their behalf. And the way that this would work in the current data economy is that one data trust or trustee would accumulate the data rights of a number of data subjects and then exercise their rights on their behalf, gaining negotiating power because they've got kind of collective bargaining ability. The data trustee then has a fiduciary responsibility back to the data subjects to exercise their data rights. So you can see the trustee is in the middle of the diagram here. The individual data subjects assign their rights to the trustee, and then the trustee negotiates on their behalf and monitors the compliance of companies, of researchers, of public sector bodies with rules and regulations. These are novel ideas about using trust law in this way. There's a data trust initiative at Cambridge that's starting to pilot some of these. But there are a range of different questions there around incentives and training for the trustees, how to make this financially viable and what financial incentives might be required and how that might undermine the sustainability of the trust, etc. Data cooperatives you might be more familiar with because there are some such as Sal's Co-op that I just pointed to that are starting to emerge. In that case, individuals voluntarily pool resources, individuals or potentially data controllers pool resources, establish an organization and then have an equal stake in that organization and its management. And stewardship becomes the common responsibility of the owners. And data would be stewarded in the interests of all of the members. So you can see that here we've got a co-op designed as with individual data subjects jointly pooling data, negotiating agreements and monitoring compliance, and then pooling their data resources to liaise with data users. There are challenges here around the ability to get uptake and scale these types of approaches, how to ensure rights, accountability, and governance when data is pooled, and how to make them financially sustainable. The final legal mechanism is corporate and contractual mechanisms, which essentially is using corporate law or contractual law to establish data sharing agreements between parties and under the remit of a defined set of aims or objectives. So the core purpose of the mechanism would be to gain some benefit beyond those of the corporate parties themselves. This is a much more complicated diagram here, but you can see right in the middle is the independent data steward, and they are that is the result of agreements established by data providers and data users enshrined in corporate or contractual law, either in a corporation or in a corporate structure or by virtue of a contractual agreement. There are questions here around how to resolve competing interests amongst various parties in the ecosystem, but also how technological mechanisms might help to ensure compliance. These types of initiatives are more likely to be using large amounts of data that are already held by corporate actors. And we see one example of this type of mechanism in the Rolls-Royce Emergent Alliance that was established during COVID, which I can talk more about in question time if necessary. But otherwise, I've gone over my time, so I'll wrap up there and happy to have a conversation with the others shortly.
Perfect, thank you, Carly. Particularly like the ladder as applied to data. I feel like that's going to be something that we and others are going to be using ourselves. And so Lee, over to you to share a bit more about AAAMD's work and the particular approach that you're involved in with the Insight Hub.
Thank you, Jack. Thanks, everybody. And thank you, HWK, also for inviting us to share our story. My name is Lee, and I'm the CEO of the charity Action Against Age-Related Macular Degeneration, mouthful. We call it AAAMD, which is the most common cause of sight loss in the developed world. We were founded by leading sight loss charities in the UK, including the Macular Society, Blind Ventures UK, and Sight Scotland Veterans. We are also the charity partner of the HDR UK Hub Insight, which is an NHS-led partnership set up to make routinely collected eye data available for health research. And our aim is to improve healthcare by making it simpler for researchers to use large, anonymized data sets of patient data in a safe and an ethical way. Now, patient benefit has always been our North Star from the beginning, and we aim to unlock health data as a formidable enabler of innovative patient benefit. Now, next slide. For most of us, of course, the most important concept here is building and nurturing trust between the patients and the public with ourselves. And in this process, we believe there are two very fundamental elements of full transparency and deliberation among equals, and that's so important. Now, this is totally aligned with the core principle of the Insight Hub, which is empowering the public and patient with real, active roles in deciding who should get access to data and for what purpose. With this in mind, we have worked with the Open Data Institute to co-create a framework which we have called the Data Trust Advisory Board, or Data Tab for short. So to avoid reinventing the wheel, we did an extensive review of different data governance structures in health and then also in other sectors, and combined with gathering up-to-date opinion from the public. And we've landed with a model where the Data Tab would have an advisory role. But because of all of our processes and recommendations will be made transparent and available to the public in a timely fashion, Data Tab will therefore have a very genuine influence on the final decision of data controllers. So in practical terms, the Data Tab was created to assess and provide recommendation on every application to access data through Insight. And importantly, Data Tab members do review the application in full, all of them, not only just the lay abstract. Data Tab also develops and regularly reviews its own criteria to assess these applications. And finally, Data Tab also provides recommendation on the process and outcomes for granting or denying requests, data access requests. So where does the Data Tab sit in the whole process? Well, here's a simplified view. The user designs a research proposal, which is then submitted using the HDI UK Gateway portal. An initial screening is done by what we call the Insight Concierge to ensure the research adheres to the 5 safes already mentioned by Andrew Morris and others earlier today, and that it fulfills contractual and technical requirements, this basic minimum. So if the application passes these checks, then the full text application is sent to Data Tab to be evaluated on higher level, non-quantifiable criteria such as purpose, value, and benefit of the research. Data Tab will then discuss and arrive at a consensus, advising whether the data request access should be granted, deferred, or denied. This recommendation is then provided back to Insight, who can then make the final decision on approval. Now, but then how do we structure a diverse and inclusive oversight group which has full access to the application and at the same time ensure it is quickly responsive and to many new possible users and from a wide variety of sectors without making it too large and complex? We've landed here at structuring the Data Tab where we do have members participating as citizens, therefore tapping into their personal experience instead of using limited, rigid, and actually temporal institutional roles. This way we also ensure that we, as members of the Data Tab, are all grounded as equals. After all, depending on the application, we never know what kind of application we are going to receive. A patient of a certain condition can actually act as a citizen. And likewise, an expert of a subject can become a lay member, so on and so forth. We are mixing members from diverse communities, sectors, and dimensions. For instance, we are looking into fulfilling ethnic, many other dimensions, including ethnic, age. We try to look at gender, geography, socioeconomic status, professional, academic, clinical, industry, policy, etc. You can see that we have been trying to cover all these different dimensions. So we can bring a group who can openly debate in a safe, inclusive, and most importantly, a cross-educating manner. So this creates really the culture of we're all in this together, to be pragmatic, grounded on empathy, and looking at the bigger picture. And straight away, this model tries, and I believe, reverts the dynamics of the usual us against them of many advisory boards, where members are constrained by the labels they wear when they join those groups. Now, all the criteria developed by the Data Tab are again fully transparent and publicly available. These were not created to catch people out, but truly is to signpost on what would be considered a constructive use of data. Now, our journey in establishing the data tab has been developed under open processes and communication, and following each critical stage, we have promptly produced blog series, podcasts, and reports, sharing our learning achievements and challenges directly with the public. And finally, for successful applications of data in the future, we will also be publishing the data tab recommendations for those, and also our feedback to the applicants. We are now finalizing the format and the content, and we'll commit to share openly through the Insight webpage in due course. With further ado, I hand it back to you, Jack.
Great, thank you for that, Lee. As always, really interesting to hear you speak about the group and the kind of environment that's being fostered within. And so lastly, over to you, Mad, to tell us more about Open Humans and the kind of particular individual-centered approach that it represents.
Great, can you see my slides? Okay.
We can, yeah.
Great, so hi, I'm Mad. I am Executive Director of Open Humans, and I'd like to share a bit about what we do and some of the work we've been doing recently. First, a bit about Open Humans. Sorry, so what is Open Humans? I would describe Open Humans as both a technology platform and a community. When we look at the platform part of Open Humans, it provides technology for individual-centered data. To look at that concretely, what that means is that people who create accounts on Open Humans and thereby become members of the community have the ability to import various personal data from a variety of sources. Some of them are related to health, stuff like activity trackers and genetic data. This can also cover other types of personal data, like social media use. These members then have access to an ability to personally exploit their data. That's via stuff like private virtual machines with the capacity to run code and create code, and they can share their analysis tools with other members of the community without sharing their own data. And in that way, we build up this ability for individuals to better understand their own data, wherever it's coming from. There's also the ability to create projects and activities on Open Humans that invite members to join them and share their data with them. So those can range from academic research studies with a traditional process, but they can also be citizen science projects and led by communities, for example, patient-led data commons that are collecting data relevant to their condition. All of this stuff is free. It's free to use for researchers, for the individuals, and Open Humans is a nonprofit. To move on, the platform is almost secondary, though, I think, to the community that has grown around it, that is interested in doing these things together. And we could take away the platform and replace it with a set of other tools. It really is these people that matter. So we do interact a lot with a lot of overlapping interests. There are people with health conditions and interests in self-research for improving health or managing conditions, understanding them. There are various citizen science projects, and there are also people very tech-oriented that want to push the edges of what can be done in terms of collecting new data or how to use it. We have online chat via Slack, online forums, and also I really enjoy once or twice a week, we're meeting each other virtually face-to-face with online video chats. Next, I'd like to share a bit about how this works in practice with how this all combined during the COVID-19 pandemic. Open Humans has been around for a while, but the pandemic hit and this became a topic of interest, resulting in a project called Quantified Flu. Quantified Flu began during community discussions in spring last year, and there's a photo of one of our meetings. And it was inspired by anecdotal reports from individuals who said their activity trackers were showing like changes in advance of them becoming aware of coming down with viral infection, in particular COVID. So everyone was interested. Can my wearable help predict if I'm getting sick? What it ultimately looked like was something that took advantage of existing infrastructure in Open Humans. So it could use data sources from various activity trackers and added the ability for people to track symptoms on a daily basis with email prompts. What it then provided for individuals was something different to many other symptom tracking research projects were providing, and that is a visualization of all of the data they were collecting. So they could see for themselves how their base heart rate, resting heart rate was changing, and other things like the temperature on their Oura ring. They could see their symptoms changing over time, mouse over it, and look at their notes. We also invited individuals to share their data unidentified as aggregate that's publicly available on the site for others to explore and learn from. This project was far from the only project. There were many academic-led research studies that were inviting people to track symptoms and share these during the pandemic. And I will not argue that it made any scientific discoveries on some large aggregate scale. It was remarkable though, because it was so different and from the bottom up. As a result, some things that happened were high-skilled contributions from various people. This included the interactive visualizations I've just told you about, as well as adding new data sources we hadn't previously supported. So support for Apple Watch and Garmin data, which is now available for future projects that might want to work on Open Humans. It provided utility and learning for individuals contributing to see whether their devices really could do that and a more realistic insight into that data. And it also had a very high rate of sustained use compared to similar projects. And I think reflecting the motivation and interest of people that created it. So we've written this up in a second round of review. The preprint is available online if you want to learn more. To close, I want to reflect a little bit on the value of small data. As secondary use, Open Humans has to be realistic in what it can achieve. While aggregates are possible, it's always going to be limited by the individual opting in to bring their data into that aggregate. I think individual and small data is still useful. One way in which small data is useful is for individuals. There are always going to be aspects of health that are going to require an individual scale understanding. This is especially true for complex chronic conditions where there is no single answer for everyone. And in addition, for people even outside of health, learning the potential of their data can be very valuable or rewarding. And then moving beyond individuals, for communities to feel a sense that they can create projects, even at the smallest scale, is really important because they can start creating and sharing solutions for types of data that might be relevant to them, pooling efforts to explore what matters to them. And so some other examples of patient communities that have used Open Humans to create data commons are the diabetes community, which focuses especially on continuous glucose monitor data, and a leader of cluster headache community who seeks to help people track symptoms and understand their triggers. But beyond health, there's another reason I think that these small data stories matter, and I think that it's for our democratic legitimacy of big data. And that is to say, when we discuss big data and make decisions around it, we want to be democratic. And to do that, it helps to see these stories and know these powers exist. Because even if we don't personally need to use this data for ourselves in our current lives, we know from hearing these stories and knowing the tools exist that power is potentially available to us. We gain an awareness when we see those stories of our own potential data and maybe an interest in what our data might do. It makes us empowered, informed, and engaged, and better prepared to engage in the collection of big data. And with that, there's a link to Open Humans, and I want to make a shout out to people I've been working closely with in the past couple years. Bastian co-leads Open Humans with me. and the members of his lab at the Korea in Paris. And also a shout out to Gary Wolf and other members of the quantified self community who have been really wonderful to work with and talk to.
Thank you, Mad. Not only a demonstration of open humans as a great tonic, perhaps, to some of the theoretical approaches that we find ourselves talking about, sometimes to hear kind of a practical demonstration of this human-centered, bottom-up style stewardship approach, I always appreciate, and an extra thank you for joining us early in the US as well. So a double thank you to you, Mad. So I've had some questions come in from the group, so we have just under 20 minutes now to discuss some of this. We won't get through all of them, so apologies in advance for that. I think one of the ones that I'll kick us off with, and perhaps directed first to Lee and Mad, is kind of how extendable do you see your approach? So to what extent is the approach that DataTab or Open Humans represents, how widely adopted or used do you see it being? I think, Mad, you began to speak a bit about that towards the end of your talk. So perhaps, Lee, to what extent do you see this approach being repeated? What are its limitations? Where is it not appropriate? I'd love to talk a bit about how do we find which of these makes sense, where and when.
Yes, thank you, Jack. So in my sense here, I think what we're trying to develop here is quite flexible. And as you know, as we've been doing already for some time, we've been publishing all the steps, right? Where we've been, where are the pitfalls, or what is useful, where is not, where can it be applied, etc., and so forth. I can see the format being adapted to many other dimensions, many other perhaps disease areas, because basically it's predicated on transparency. And if you can bring that transparency onto the table, you start getting a lot of people who can see themselves being represented, who can see perhaps some of their perceptions and opinions being replicated. So we're not second guessing how these groups arrive to certain conclusions. And finally, I'd like just to highlight as well another thing, which is adoption of these middle layer, if you like, of data stewardship, yes, where we are asking a smaller group to do the heavy lifting, read all the work, right, read all the applications, try to come up with that understanding, and becoming that link with the wider society. I think that is something that can be easily brought to different dimensions or applications. But also that helps us to be able to address many of the innovative applications quickly. So instead of actually always having to look for experts so we can analyze a specific new application because we don't understand them, having some group which is a little bit more, I wouldn't say permanent, but actually consistent there, who already can understand some of the process behind those analyses, would definitely help in this fast pace, right? Think of COVID. No one knew about COVID before. If we are to build a steering group to understand COVID, we will still be sitting and deliberating what that would be. Sorry, it took me a little bit longer rambling, but I'll pass the word to Matt.
Well, with respect to open humans, I think it's entirely possible that projects grow up and they discover that the extra layer of friction or interaction that has to occur by operating on the Open Humans platform is no longer needed. They create their own custom app and data management infrastructure. And I think that's wonderful if or when that ever happens for any project. But for anyone to get to that place, I think it's really important to have a place that's where innovation is easier, where you can be trying stuff out on your own data, inviting a couple other people to do things together with you, inviting a small group to put data together. That's an important space where larger projects may or may not grow. Not every one of those projects is going to scale up. That's okay. That's the point. Innovation is supporting the innovation is important.
Jack, can I ask questions to Matt and Lee?
Of course.
So I'm just so interested in both of the projects. And Matt, I was wondering, I imagine the group of people in your community is relatively self-selecting in the sense that they must have a certain level of data literacy, and they're probably people that are quite comfortable with technology. And I just wondered the extent to which that, do you think about that being problematic from the perspective of like the representativeness of the data sets you're compiling? Does it affect the modeling that you want to do, those types of things? That's one question for you. And for Lee, I was wondering, are you able to publish any statistics about the amount of applications that Data Tab denies or sends back for review, and like just to get a sense of how often does that happen or not? I imagine in the context of like a group dynamic and negotiating those types of things, it's quite challenging. So I'm just interested to hear that if possible.
So I do worry a lot about the potential divides between like the techies and data savvies and those who are not. One thing to reflect on is that someone's use or engagement with Open Humans as a platform or community doesn't have to be very heavy at all. So they can move through the opt-in like authorization process without engaging further. They don't have to be exploring their data or analyzing it. So it is entirely possible to not need to do those things. But another reflection that I've had and I've come to in the more recently in past years is that growing data literacy is going to require working with the people who are most literate and bringing them alongside the people who are a little less literate and a little less literate. It is going to be a process that cannot just jump all the way to the end. And so providing a space for everybody to be learning from each other and sharing their expertise is really valuable for growing that in a natural way.
Right. Carly, thank you for your question. Yes, about learning of the process. Let's talk about how we do with successful ones. Then I tell you what we are planning to do with unsuccessful ones. The idea with successful ones, and we are still working with the stakeholders, is to examine, whether the existing, you look at UK Biobank, they do publish a lay summary. But our question really is that sufficient nowadays, 10 years after the Biobank was set up? Now we understand data better. Do we want a little bit more detail around those, right? Also, in many cases, we know that the lay summary is written in a really watered down version, and that doesn't really help building the collective understanding of how the data is used. Now, we'd like to try to balance that effort by, one, for all the successful applications, try to, if you like, make transparent or externalize a little bit better the why it went right, why it was approved. These will not always be plain sailing, right? So whenever there are some places where some of the criteria were just passable, then the recommendation of the data tab will also follow the publication of the lay summary. So then we were all learning, not only the public to see how this is being evaluated, but also for the future applicants to understand, here's a signpost, and we don't want to really stop you from using the data, but we'd like you to take this best path that others have agreed already on. On the failed application, that's a bit more problematic because whenever they fail, sometimes there might be some reputational damage there for the applicants, right? Well, one way or another. I'm not saying there's always going to be a damage in reputation. Perhaps they just didn't think about it, or the data set is not suitable for that research, right? We don't want to have applicants to be holding back on application just because they think they will get a public kind of telling off and their name published and the idea being published, right? So on that, what we plan to do is to just perhaps at the end of cycles, once a year perhaps, collate those who have not been successful and say general comments are these are the main reasons for failure, and also publish the scoreboard of how many applications and how many successful. Hope that helps.
Great, thanks, Lee. I think that speaks to some of understanding patient data's work on the idea of learning governance as well, and how this is kind of a cyclical rather than a linear piece. Also interested in the fact that we'll be on to talk about data governance as well, which I think is an interesting frontier. So some quant evidence for some of the things that we've been talking about today, I think is perhaps we can have a panel on that in a year's time if HDR have us back. Another question that's come up is around competing interests. So MAD in particular, perhaps, I'm interested in where there might be some misalignment of incentives and ideals and values in the community, and kind of how that's negotiated, or perhaps some of your reflections on where there are some competing interests or different interests within that group, or some of the subgroups perhaps that interact with the platform. I'd love to hear about your experiences with that.
I'm thinking, like, where are the frictions? And I'm not sure I'd characterize them so much as a competing interests as like speaking different languages, where people, especially if they haven't tried to use data yet, have like visions about what they want to do or what they see that data as being able to do. And it can be very difficult when they're interacting with people who have been using the data and know pragmatically the limitations and difficulties in those like data collection and cleaning protocols. And it can be hard to bridge those gaps and try to bring someone in without making them feel excluded, because you don't want to do that. So for me, that's some of the biggest tension is you want to help someone engage and understand this, but also all the limitations and difficulty entailed without making them feel like you're just shoving them back out the door.
Jack, may I comment quickly on that point as
Sure.
well? I think it's really important, which is there's always this challenge of how do you make everybody feel included when you cannot expand this group to, I don't know, hundreds or thousands of people have their voices in. And then one initial kind of pushback was a lot of people with, rightfully so, with different conditions say, well, why am I or my condition not represented in data tab or in many of these governance models, right? And then we always try to bring them back to, well, the idea here is that we can't always have all the conditions or all the science represented within this panel, and therefore the idea of citizens, where people are going to be extracting themselves from their own personal condition. Even though, for instance, I am working primarily with AMD, I am looking at preserving eye health, and that would cover everybody, you see? So I think that will be another dimension that we will be seeing once this concept of data stewardship is expanded. But more importantly is that we keep this as a dialogue and not, again, as we said, us against them. We bring everybody on the table. We can all discuss, record that, and share it openly. So everybody knows that, yes, there was no favoritism. People were really pragmatic about thinking from the general population or the bigger good, right? The larger societal good.
Thank you both for those thoughts. Really interesting, and yes, Lee, that idea of how to sample for diversity in what is a fairly small sample of a broad population is a real difficulty in some of these processes. Slight change of gear. I'm interested, Carly, as Ada working across different sectors, not only health like the ODI, interested to zoom out a little bit, perhaps for the last 5 minutes or so that we've got, and interested in your thoughts and kind of reflections on the degree to which the health sector, and perhaps more specifically health data research, sees data as something to be stewarded in comparison to some of the other sectors and domains that we find ourselves working with and speaking to. So yeah, thoughts on that would be great.
Yeah, it's a great question, Jack, and it's a very timely question too, obviously, because there's so much happening in the news at the moment with the GP DPR initiative to bring GP data to NHS digital for access for researchers and for external actors, and also the health and social care data strategy, which was published this week, which also similarly indicates numerous intentions for the Department of Health and Social Care to get access to data across a wide range of actors in the health system and then use that for a range of purposes. I think that our experience is from the perspective of healthcare practitioners, there's a very strong understanding of the need to think about data as something to be stewarded. There's a kind of innate sense of responsibility. There's a cultural kind of ethic of care, which imports confidentiality chiefly into thinking about data. So I think from the perspective of frontline workers and practitioners and medical staff, there's a very strong sense of the need to think about data as something that has to be stewarded. And perhaps overly so. I think that one of the things that the health and social care strategy is trying to rectify is perhaps too much segmentation of data, too little willingness to share across the system. And maybe I think some of that is infrastructural, which is that there are differential digital systems in trusts, in GP data surgeries that make it hard to make data interoperable, but also potentially cultural barriers to sharing because of this like very long-held cultural affiliation with confidentiality. So I think that's on the one side of the coin that exists. On the other, I think we see, real potential for the use of data in the health sector. I think COVID has just kind of blown that open in really interesting ways, potentially created too much or overblown the excitement about data. I mean, I don't want to overstate that. I think the data, the clear connection between data and the ability to respond to the crisis is unarguable, and particularly in the context of vaccine development. But there has been a sense that this is now a good time to seize on opening up a lot of health data for the purpose of health research. And I think the public response, or what some would say backlash to the GP DPR thing, shows that perhaps there's not yet public support for that full kind of widespread opening up health data to all actors everywhere. And I think this goes back to something that we know, and Jack, you know very well, which is people think about privacy differently when it comes to different actors. They hold trust in different ways depending on who the institution they're interfacing with. And people trust the NHS more than any other British institution, essentially. But that doesn't necessarily extend to other actors in and around the health system, and particularly doesn't extend to private sector actors. And in fact, the opposite is true, which is after many years of bad treatment by the private sector, most people feel very low levels of trust in corporations, particularly big tech corporations. So that's a really challenging context, I think, which is there's so much exciting things to be done with data, health data. There's a lot of new potential in new technologies to use health data in interesting ways, and there's a pandemic, and that's really underscored the need to use health data on the one hand. On the other hand, there's tenuous public trust in a range of different actors, and that has to be, those two sides of this coin have to be kind of resolved, I think. And the way you resolve it, I would say, is through these mechanisms for data stewardship, is by building participatory models, by building technical platforms that enable people to be more in control, by building in advisory boards and other forms of people engagement, and by better consultation from government to people in the health and social care system and to citizens. I think at the end of the day, the problem with the GP data issue was really this sense that they were trying to kind of get it through quickly on the coattails of COVID, rather than doing a proper consultation process that really made people feel like they'd been brought into the conversation. I don't think people are adverse to sharing health data. I think most people want their data shared and they want to contribute to the public good through health research, but people do feel like they've endured many, many years of bad treatment of their data. And that means that any initiative has to kind of overcome that quite high threshold, I think, of public trust. So it's a very long-winded answer to your question. I'm sorry, I just saw that took me 5 minutes to answer. My apologies. But it's a complicated question, I suppose.
No problem at all, Carly. You brought us back and you reconciled the two sides of that coin in a way that I certainly couldn't have done. Lee, Mad, running short of time, so maybe a short response to that, and or a reflection on the conversation. So kind of one sentence, if you will, for both of you to close us off.
My reflection would be trying to help people move from thinking of it as data about you that somebody else holds to their data.
Thank you, Matt, and to Lee.
Yeah, I'd like really to also mirror that. We all hear that everybody wants personalized medicine, better treatment, and yet not with my data. How does that is possible, right? And I don't think, I think I'd like to really shout out there, you know, instead of saying, please don't use my data, respect my privacies, please don't leave me out. I want that my data is included in the big analysis to bring the innovation that will help me eventually one day in the future. And final one is that let's not forget everything we experience today in the advances of healthcare came from data and output of very kind people, generous people who actually donated or shared the data in the past. Why should we not pay it forward? Right? We will have kids, we will have relatives. Why not also be part of this movement in the future? So I just want to bring this in contrast to what's being kind of pushed out by the larger media at the moment.
Perfect. Thank you all. Really positive note to end on, and a positive slant on data stewardship. I'm likely about to be told off for running slightly over, so we'll depart there. Thanks again to the panelists and for HDI UK for having us, and thank you for joining us this afternoon to our audience.
Thank you. Bye-bye.
Thanks, Jack.